also congratulated all the doctors for all the hard work that they have put in during COVID. What work they have done during COVID, it is easy to say that the number of lives that we have lost, but we did not lose this number of lives because the doctors did a bad job, but the doctors were fighting day in and day out. It was a learning experience for us. It was a learning experience for us. Overall, COVID was it was an unknown enemy that came across globally. And as a result of which, the work that has been done by Goa Medical College is phenomenal. I want to also mention to my colleague Viresh Burkar that this is not my first tenure as Health Minister. This is my third tenure as Health Minister. And I've also offered him that whenever he wants anything, just to mention to me, and I will take him around Goa Medical College because his constituency and Mr. Rudolph's constituency, they are the members of that particular area. So involve them in many things, and I also take you and show you exactly how we have been managing Goa Medical College. Speaker sir, managing Goa Medical College today is not something that is very easy. It's also very challenging, and it is also something that we all know, all of us have at some point of time taken help and taken treatment from that same hospital. Today it is the truth, Speaker sir, that when the cut motions have been raised and cut motions on various issues, that Goa Medical College, all of us agree on one particular point, that it is one of the finest institutions in the state, and some of the facilities that we offer there are much better than any other private hospital that we offer. I also, many of the members have also mentioned that what needs to be done to further strengthen Goa Medical College. But for that, we require that type of funding also. It is not easy. Even funds, whatever, 100% we are allotted and we consume. But we need to see that how to move forward in a very meticulous manner. That's why I have recently had a meeting with the Secretary Health, Dean Goa Medical College, and we have said that immediately when the session is over, that we will go and meet, Speaker sir, we will meet Dr. Paul from Niti Aayog and also take some ideas. What is the way forward? Now we are at this particular juncture and prepare a proper presentation. Is number of patients that we deal with, this is giving the whole demographics of the state, what is the type of disease that we generally come across, what is the lifestyle disease that are increasing. And this cannot be done unscientifically. This has to be done in a very scientific manner in what are the type of specialties that we need to increase. Speaker sir, I remember my former Chief Minister Shri Manohar Parrikar today, because he was the one who started the cardiac facility in Goa Medical College. And it is today that same cardiac facility has saved the lives of several people in the state of Goa, and even for people coming from outside the state of Goa, Speaker sir. Speaker sir, आम्ही जेन्ना म्हणटा की आमकां ह्या तरेच्यो फॅसिलिटीज जाय, गांवांनी प्रत्येक आमदाराक दिसता की आपली फॅसिलिटी एक वेगळ्या तरेन त्या तरेची सोयी सुविधा थंय उपलब्ध करून दिवपाची गरज आसा. राजेश फळदेसायान सांगलें की आपले मतदारसंघ स्प्रेड आउट आहा, कांय कडेन आयलँड आहा, कांय कडेन तुजे कडेन एम्ब्युलन्साची शॉर्टेज आहा. पूण तुमी एक समजून घेवपाची गरज आहा की आमी मुद्दम म्हणून तें करिना. आमचे कडेन जे कितें रिसोर्सीस आहा ते आमी रॅशनलायज करून ते आमी भागोवन घालून सगळे कडेन आमी लोकांची सेवा करपाचो आमचो प्रयत्न आनी उद्देश आहा. हांगा एकूच लक्षांत आमी घेवंक जाय की आरोग्य क्षेत्रांत राजकारण म्हणटा तें कशेंच येवचें ना. बाब बेन्झीन म्हाका एकदां एक वराचेर फोन करून हांवें ताका रिस्पॉन्स तेन्ना एकाक दिला रातचो, आनी पेशंटाक त्या तरेचे ट्रिटमेंट, योग्य तरेचे ट्रिटमेंट दिवंक जाय. विजयाक खबर आहा, बाकीचे कोण उलयता आनी सांगतात की ट्रिटमेंट आमकां ह्या तरेची, त्या तरेची ट्रिटमेंट दिवपाची गरज आहा. लास्टाक म्हाजे आई वडील बी जेन्ना बरे नासले, आमी गोवा मेडिकल कॉलेजानूच आमी ट्रिटमेंट घेतले. भिवन आमी कांय प्रायवेट हॉस्पिटलान वचूंक ना. कांय लोक गेल्ले प्रायवेट हॉस्पिटलान. आमी थंयच्या थंयच गोवा मेडिकल कॉलेजान ट्रिटमेंट दिवन आमी जे कितें ट्रिटमेंट दिवपाचो आहा, ट्रिटमेंट प्रोटोकॉल ह्यो सगळे फॉलो करून कोविडाचो काळ, स्पिकर सर, हेज्या खातीर मातशे कांय गोश्टी फाटीं फुडें जाल्ले आसा. Full objective of the government at that point of time was on ensuring that we provide proper COVID care to the people of the state of Goa, as a result of which surgeries, and it's not only Goa, it is globally this was happening. If you look at Dr. Shetty is there, his hospital also he has seen, because we took some amount of beds, I think all the private hospitals pulled in. But you have to understand is that as far as the Goa Medical College is concerned, Speaker sir, and just now there was a question that was asked about the super specialty hospital, why the super specialty hospital is not getting commissioned. Super specialty hospital just cannot get commissioned just like that. We have already taken, I was just talking, asking the Dean, because I had asked for specifically What are the 3 other things that we want to start in the super specialty hospital? One is a cardiac, which we are moving to the new super specialty hospital. We have also taken on board Dr. Sanat Bhatkar, who is a young doctor who's been trained by a top specialist in Bombay, Dr. Karapurkar, who has already joined. On our commitment that we will give him a higher salary, it is necessary. Specialists don't come for free. And it is important because coiling is very important, because strokes also, cases of strokes also are increasing. And having this person who does coiling, and just the other day we had a meeting with him, and also a couple of cases have been already done, but we need to strengthen this department. They require a separate cath lab in the neurosurgery, and they require a separate CT scan under that. So that's what we are taking forward, Speaker sir. स्पीकर सर, हॉस्पिटल घातलें आनी हांवें जुनें गोवा मेडिकल कॉलेज जर फक्त नांवा खातीर म्हणून हांवें थंय शिफ्ट केलें, तेजो कांय अर्थ जावचो ना. आनी त्याच बरोबर डॉक्टर अमित म्हायदेवाक मुख्यमंत्रीन सँक्शन दिल्लें आसा कॅबिनेटान, आनी डॉक्टर अमित म्हायदेवाक ऑन बोर्ड घेवन तेंचें कितें इक्विपमेंट आहा, ते रिक्वायरमेंट आहा, ह्यो सगळ्यो गोश्टी जाग्यार घालपाक मातसो वेळ लागता. आनी त्याच बरोबर आमकां कॅथ लॅब नवे घेवचे पडटा. कॅथ लॅब पयर हांवें डॉक्टराक आपूण हाडून सांगलां की तुमकां अल्टिमेटली द सुप्रीम कोर्ट ऑल्सो सेज इफ द एक्सपर्ट्स गिव अ पर्टिक्युलर व्यू, whatever equipment you want, they are supposed to justify and they are supposed to defend it, and we are supposed to procure it. And that's how we need to move forward. And also robotic surgery center in the SSB, basically for thoracic surgery. आणि हे सगळ्या गोष्टी आमकां, हे 2-3 गोष्टी तरी आमकां ह्या हॉस्पिटलान आमकां करपाक जाय. स्पीकर सर, गोवा मेडिकल कॉलेजाची एक वेगळ्या तरेचो प्रवास चाललो आसा. कोविडाच्या वेळार बी ते सुपर स्पेशलिटी हॉस्पिटल आमकां खूब फायदो तेजो जालो. आनी स्पीकर सर, आमी एक लक्षान आमी घेवंक जाय की आमी सगळे जे MLA हांगा आसा, आमी खंय ना खंय आमचो संपर्क गोवा मेडिकल कॉलेज कडेन दिसान दीस येत आसता, आनी आमचे डॉक्टर बी तांकां त्या तरेचे सहकार्य करता. कोणी उल्लेख केलो की आपूण रातचो गेल्लो पूण थंय PRO बी नाशिल्लो, आनी आमी आतां 3 नोडल ऑफिसर, डॉक्टर 3 नोडल ऑफिसर घालपाचो आमचो प्रयत्न, म्हणजे रावंड द क्लॉक तुमकां आमी नंबर शेअर करूं शकता. एकदां आमी डिसिजन घेतल्यार म्हणजे तुम्ही त्या डॉक्टरा कडेन तुम्ही संपर्क साधून म्हणजे तुमचो पेशंट योग्य तरेन तो फुडें पावूं शकता आनी ताका योग्य तरेचे अपडेट तुमकां गावतले. पूण म्हाका एक सांगूंकशें दिसता की आमचे ICU पासून सगळ्यो गोश्टी, आमचे मेंटेनन्स जे आहा, आमी चड भर मेंटेनन्साचेर घालतात. तशें हें ना की CCU आनी AC चलना बी, तशें जावंच शकना. कारण पेशंट तूं जर गेला केन्नाय जर वयता, ना एक मिनीट, ना हांव उलयतां, मागीर तूं सांग. ना केन्नाय
त्या टायमार हांवें हें करता, बिकॉज हांवें तें सांगलां कित्याक कळोवपाक लागलो लोकांक
बरोबर
जाला म्हणून. आनी इट वॉज हें अशें न्हू की बाबा एकूच दिसा घाललें, ते 3-4-5-6 दिसाक ते कंटिन्युअस चालू आसलें.
ना ते स्पीकर सर कितें आहा, हांव तो चुकीचें उलयतां म्हणून सांगना, आनी हांव काय डिफेन्साचेर रावना. पूण कितें आहा, तशी कशी गोश्ट जर घडली, एक WhatsApp धाडून दी. तुजे बड्डेचेर हांवें WhatsApp धाडलेलो, रिप्लाय काय येवंक ना, बड्डे काय कितें आशिल्लें. पूण हांव म्हणटा, हांवें तुका हॅपी बर्थडे म्हणून धाडलो, म्हणजे तूं WhatsApp वाचूंक जाय मातशें, कित्याक नाजाल्यार आमचे सारके तुजे जर कामां आशिल्ल्यार आमी तरी तुजें कामां करूं शकता. म्हणजे आमकां मातसो रिप्लाय दी, म्हणजे आमी तुजें काम कितें आसल्यार ताबडतोब हांव डिनाक विचारून तेजी चवकशी करूं शकता. मेन म्हणजे कितें आहा की स्पीकर सर, हे जे सगळे जे आसता गोवा मेडिकल कॉलेजाचे आतांच उल्लेख केला, आमचे कडेन सगळ्यात टॉप क्लास डायग्नोस्टिक्स फॅसिलिटीज आहा. आमचे कडेन सगळे तरेचे आमी डायग्नोस्टिक्स अपग्रेड करपाचें आमचें काम चालू आसा. वायरोलॉजी लॅब पासून तरेतरेचे गोश्टी जे आमचे कडेन नाशिल्ल्यो पयलीं तुम्ही 15-16 वर्सां पयलीं जर पळयल्यार गोवा मेडिकल कॉलेज आनी आयजची टेस्टिंग फॅसिलिटी थंय पळयल्यार जमीन आसमानाचो फरक आहा. आनी हें सरकारान केल्लें आसा, आमच्या सरकारान केल्लें आसा. सरकारान रावन आमी कितें तरी कॉन्ट्रिब्यूट करूं शकले. डॉक्टराची टीम बरी आसा, डॉक्टर एकदम बरें काम करता, आनी ह्याच तरेन आमकां फुडें वचूंक जाय. Speaker sir, there's lots to be spoken on several subjects, so I'll just take the highlights which are common points of all the members. FDA, somebody asked me to give me the number of tests that FDA is doing. FDA's record, I will give you, I can't get who may ask me that question, but it is here somewhere. But FDA is on a regular basis carrying out raids and carrying out other things. But I'll tell you one thing, it is not for basically, like somebody mentioned, Shri Digambar Kamath mentioned, to harass a common man, but then they have various other methods in sensitizing people in seeing that hygiene and all is maintained. South Goa office was a demand, that's why I said you don't need to wait for an inauguration, just start it and let it start, so that we have posted certain people there, we will reorganize it. So whatever needs to be done, whatever is done. Now our department has got awards for last 4 years continuously for whatever work they have done. FDA director is doing a good job, and the whole team there is doing a good job. As far as Madam Dilaira Lobo asked about the testing, testing is 24/7 at the borders. It is being done by QCI, and whatever as per the norms centrally, Kumcha timer, in Vijay's time we had started it, and it's going on. And we are checking it. Random checking also, sampling is taken and it's done in the lab. We have got a state-of-art lab. It's being done there. Yes, and also somebody mentioned about testing of these fruits and other things. This is a constant thing that we do. And it's constant, at the roadside, they sell these mangoes and all during season and all, because basically for artificial ripening. All that is being done, Speaker, sir. As far as the Department of Health Services is concerned, 108 onwards to outreach programs, breast cancer screening program. Somebody mentioned this cancer is on the rise. Super specialty hospital, I just mentioned what is our role and what is it that is the vision of the government for the super specialty hospital. I also want to mention to you, Speaker, sir, is that the tertiary cancer center that has also been sanctioned by the Chief Minister. This is a project that was sanctioned by the Prime Minister of the country, and that is specially given to us. It costs somewhere close to around 277 crores, where we will get a professional on board, and we are following all formalities so that we are able to run this particular tertiary cancer center. तुम्ही जे उल्लेख करता की गोयचो लोक वचून कॅन्सरा खातीर आयज कॅन्सराचो रोग इतलो वाडला की आमचो मनीस जर थंय गेल्यार तेका it becomes really a problem for him to go to Bombay or to go to Tata Memorial and to take treatments, because गरीब मनशा कडेन जायना ते. आणि आमच्या in our state, we are the only state in the country, as far as Goa Medical College is concerned, that we are giving free medicines to inpatient and also to OPD patients that who come to the casualty, not only in the Goa Medical College but also in the periphery. तांकां कितें लागता, maintenance खातीर कितें लागता, insulin कितें लागता. Nowhere else in the country that this medicine is being given. I just want to mention to Venzi also is that our population wise, our outreach of our PHC and CHC is far wide. But unfortunately, what has happened is restructuring had to be done. Restructuring has to be done. Kandolim has already outlived its time. It requires to go, it has to become a community health center. I will take it up on a war footing. I had given an assurance to Honorable MLA that I will take it up on the war footing. We had a function there. That has to be done. That has to be broken up, and then Saligaon needs to be, Saligaon has to have another one, so that population has grown. And this, what has happened is we have continued to call them PHCs. PHCs, then under them, there's a whole structure of, it's not easy. If I just make an assurance on the table of the house, all these years, all of us have to work. You want your constituency to see that you have a better kind of a network. You are, as an MLA, be able to perform. How can you perform? By seeing that you are in a better position to provide healthcare and taking it from the government and giving it to your people. But what happens, it is not easy. Everywhere within whatever resources we have to manage and rationalize. Whatever you have mentioned about your 7 staff and 8 staff and all, I will take care of it. Whatever Cruz Silva has mentioned, his issues will be addressed. As far as Girish Burkar is concerned, my only appeal to you is just drop a message anytime anything is there. You're free as a member of the assembly to go wherever you want in the Goa Medical College and check. It's in your constituency, but drop a message so that it's brought to my knowledge also, so I can immediately act on it. Speaker, sir, we have 2 district hospitals, and I want to assure Vijay Sadesai is that South Goa District Hospital, when that South Medical College comes, it will come. But immediately what we are doing, what Secretary has gone and is moved for approval, is to put a critical center there for criticare on the 4th and 5th floor. So I will move the Nursing Institute to the old Auspicio and a neuro rehab also to the old Auspicio. Burgyang tras jitko jata, and all these things. There is an early detection center and all in the old Auspicio. So all this will be, all this I want to actually bring under South Goa District Hospital. I have already told Secretary and the Director that there was certain hesitation. I said, no, it has to be under one roof. Everything has to come under one roof. You cannot operate 2 places. And under NHM funds, we will try to get this renovated, just like how the old Asilo was renovated, and then we are using it for training and other purposes. We will take it forward in that direction. I just want to make a mention that the Tertiary Cancer Center is going to be one of another flagship programs and a hospital of the state of Goa, Speaker, sir. This type of treatment that will be available there. We are also working on the PET scan, getting the PET scan immediately so that people are able to use the PET scan. We have already tied up with somebody to get the PET scan and some other facilities. But we need a full-fledged cancer hospital. we need a full-fledged cancer hospital, and I can assure the House that whatever is done in our department will be done very transparently. There will be nothing, no hanky-panky. Everything will be done, and also we must get people of high caliber to associate with our institutions. During COVID, we tied up with Global Institute of Yale Global Institute of Health, International Health, so that we were able to exchange, our doctors were able to exchange ideas. Now COVID is over, now doctors can travel. We also tied up with the University of Miami, because there was an ex-alumni of our college only who helped us get this arrangement, agreement, everything was drafted, everything was approved. But there, that to treat people beyond the golden period after the, for strokes. So ह्यो सगळे गोष्टी करपाक आमी हातीन घेतल्या. Today, after post-COVID, I think, after the elections,
Speaker, sir, under Rule 16 of the Rules of Procedure and Conduct of Business, I move a motion to extend the duration of the sitting of the House by
another 45 minutes.
1 hour.
Sitting of the House by one hour. Those who favor aye.
Aye.
Those who favor no, the ayes have it. Ayes have it. The duration of the sitting of the House is extended by 1 hour.
Speaker, sir, so speaking of all this, we have to understand that how do we move forward. One thing I want to assure each one of you, you wanted specific questions on, now recently, last year, there was an issue which you mentioned about the Niti Aayog, which the Secretary has sent me a note, is that this year we are one of the few first states to take the money. There is no gap as such, but maybe because of COVID that time there was a issue. And also second thing is, as far as health services concerned, Speaker, sir, I would like to appeal to all the members. We discuss always generally during the demands. And demands is a place where we raise our voice voice our concerns about our constituencies. But after the assembly also, please drop a email or drop a letter. Exactly what are the priority areas in your areas pertaining to these portfolios, so that I can address it individually and individually call for meetings and take it forward, because otherwise it just becomes like I have done my duty of answering you in the assembly and that's the end of the story. Then after that nobody sees. But I don't want to do that. My only appeal is that you drop a mail or ask for some time. We can sit down and we can address the issues constituency wise, issue wise. If there is anything, Anganwadi issue, Speaker, sir, health services and इतले बरे काम करता आमचे ANM and प्रत्येक कडे. Now what we are trying to do is we are trying to provide semi-auto analyzers also at the sub-health center, so that along with the new wellness centers which have been sanctioned, which is the dream of the Honorable Prime Minister Shri Narendra Modi ji, that we should have wellness centers. We have got wellness centers, we are increasing those wellness centers, but त्याच बरोबर sub-health centers also we are trying to have semi-auto analyzers, so that people don't even have to come to the PHC or CHC to take their blood or get this blood tested. So this becomes a very easy thing for them, and nobody is going to charge them. पहिली परिस्थिती कितें आशिल्ली, स्पीकर सर, की खंय तरी कोण तरी कंपनी वेगळ्या कंपनीचो मनीस येतालो गोवा मेडिकल कॉलेजान, त्या गरिबा कडल्यान 2000 रुपया तेजे कडल्यान घेतालो आनी तेजे रिपोर्ट्स यूज टू गिव दोज रिपोर्ट्स. ऑल दॅट हॅज स्टॉप्ड. वी हॅव स्टॉप्ड ईच एंड एवरीथिंग. They used to come like bandicoots there and really suck the blood of these poor people. You are aware of it, that we stopped all this. I think when earlier tenure of mine, we put a full stop to all this so that people don't come, and everything in Goa Medical College is provided free of charge to the people. Speaker, sir, health services, 108, we have got neonatal ambulances, we have got several other facilities, cardiac ambulances, we have got doctors on cardiac ambulances. Speaker, sir, our program of STEMI, which I must not forget, because the doctors of Goa Medical College and health services together, today even in America you go, thrombolizing is done by a MD, not by a medical officer. But in Goa, thrombolysis of a patient is done by a medical officer, which is an important and proud moment for all of us, because a medical officer is doing thrombolizing of a patient. And this is not done anywhere else. So, Speaker, sir, if you look at it, what the state of Goa is doing is far beyond what other states in the country are doing. We are a small state. We are a government that is governed by the vision of the Prime Minister, and which vision we take, and we go with the outreach to the people to save the lives of the people of the state of Goa. So same thing what we want to do is for thrombolizing of the patient for strokes. As a result, we are trying to make the hubs as the district hospital, the North Goa District Hospital, South Goa District Hospital, and Ponda. sub-district hospitals, so that we are able to treat the people. People should not die because of stroke. People should be able to save their lives, and if we have to save their lives, then hence what we have done, we have tied up with HLL, which is a public sector undertaking, to carry out a hub and spoke model. They will provide the diagnostic equipment everywhere, and they will manage the diagnostic equipment. So this excuse of radiologists not being there, technician not be there, that issue will go away. Speaker sir, healthcare chair, if I have to talk on healthcare, I think the whole time will only go on healthcare. Second thing is, apart from this, if there's anything that you want in terms of your constituency, Prevendra Shet talked about my constituency, somebody mentioned about all the, irrespective of all these things, we need to start working on integrated models. If there is a project coming up, then we should ensure that those Anganwadis also in those areas. Now that happens in urban. I can talk from urban point of view because urban development is with me. But then the problem is that everywhere, these sub-health centers, Anganwadi centers, Honorable Chief Minister has been kind enough to give us the schools, whatever been available. But in addition, we will require more schools, which will put a proposal accordingly, because these all structures are old structures. Today, the rent comes from Government of India, from the scheme of Government of India, which we have further revised. And there's a ceiling on that. The ceiling is 1,000 in rural and 4,000 in urban. So I cannot go beyond that. So as a result of which, the Anganwadi teachers, and they manage, how they manage, that itself is art. Because they convince the landlord, what they do, they manage, but no. I don't agree with your point of view that they pay, because I take reviews with all of them on a regular basis. If any instance is there where they pay, I think that will definitely come to my knowledge. This has happened in the past, but it's not happening anymore anywhere. And sometimes what happens is that we take a review right from the CDPO, right to the teacher on a regular basis, to the Mukhya Sevika, so we exactly get a first-hand information exactly what's happening in the department. Speaker sir, WCD is another department where we are trying to see that the best of nutrition, and even several other schemes have been modified. This department basically runs on Government of India funding. Whatever is there, we are doing. Now, Vijay mentioned, I will take up the issue accordingly with the Honorable Chief Minister, because Swavalamban is a very important scheme for us, and that we will take it forward. We have helped so many people in the past. We have told people to take benefit of the schemes, and people should take benefit of those schemes. Actually, Mr. Digambar Kamath will know. I had also mentioned last time is that you should take benefit of those schemes in his constituency. But everybody should come forward and support and help those our CDPOs in order to, help you get those schemes. But now we have made it, we have decentralized it, we have made it available, these schemes at the head office, but you can fill the forms and give it at the CDPO level itself. So simplification of all this, nutrition, Public Health Foundation of India कडे आम्ही टायअप केले, म्हणजे रिस्की प्रेग्नन्सीज जे आहा ते आम्ही ते सारखे मॉनिटर करून ह्यो सगळ्या गोष्टी, म्हणजे इन्फंट मॉर्टॅलिटी कमी जावचे, योग्य तरेचे न्यूट्रिशन आम्ही आमच्या महिलांक दिवचे, हे सगळ्या गोष्टीचेर आम्ही काम केल्ले आसा स्पीकर सर. आणि त्याच बरोबर WHOचे रिप्रेझेंटेटिव्ह जे ऑल इंडिया हेड हा, ती आमचे बरोबर काम करपाक फुडें सरल्या. मॅडम स्मिती इराणी जेन्ना गोंयान आयली स्पीकर सर फाटले फावट, आमचो एक कार्यक्रम जाल्लो, आनी तिका इंट्रोड्यूस म्हाका केलें, आनी तिचे बरोबर आमी हांगा, ती मध्य प्रदेश व्हडल्या प्रमाणान काम करता, तिचे बरोबर आमचे WCD डिपार्टमेंट गोंयान आमी काम करपाचो आमी फुडाकार घेतला, आनी शी विल सेंड द MOU, and that's how we plan to move forward, Speaker sir. As far as FDA, as far as health services, as far as all these WCD, all these issues are concerned, Speaker sir. अंगणवाडी वर्कराचो इश्यू जे आशिल्ले, तुमच्या मनान जे आशिल्ले तुमी सांगले, ते प्रत्येक गोष्ट आसाच इश्यू ना अशें ना, पूण इश्यू सॉल्व करपाक मातसो वेळ लागताच. खंयचोय सरकार आयलो काय रातोरात काय आमी चमत्कार करूं शकना खंयच्याच गोष्टीचेर. पूण आतां तुमचे दिवार आयलँड आनी आमी तेन्ना 108 गाडी हाडलेली, खुबशे 108 आमकां तेन्ना आमी विड्रॉ केल्ले. वी हॅड विड्रॉन दोज 108 बिकॉज ऑफ कोवीड, बट नाव वी आर रिडिप्लॉयिंग देम. We will now automatically get under NHM some more additional new ambulances, and then we'll replace them wherever they need to be placed. You can always put in a request. We will ensure, and we are monitoring where the calls are coming from. When an ambulance is placed, ambulance is not placed because I want to place an ambulance. Ambulance is placed based on the number of calls from where the calls are coming. There are specific places where cardiac cases, Panjim is one area where maximum cases come for cardiac. Then there is another area which comes, so these are specific areas which we need to monitor very closely. We had got under CSR, we had got the cardiac ambulances. We need more cardiac ambulances. We will work towards getting it, and we will make sure that South Goa District Hospital, as committed to you, yesterday or day before, I think just on Friday, I think we had a meeting with Dr. Guru Prasad Naik and the Dean. And we have told them that this is a commitment given in the House. We have Chief Minister, myself, both are on record of giving this commitment. Actually, when we went to Consolim, we made the commitment that South Goa District Hospital will have its own cath lab. Dean is already working on the neurology and neuro setup there, so that any accidents, you don't have to come here. In addition, whatever we can do, because that hospital has to be fully utilized. You cannot have just a shell and like a white elephant standing there and tell the people of South Goa that we have built a hospital and that's it. That cannot happen. We have to work. There are issues which we are addressing, we will address. And we will address it taking you with us, because we can't address any issue alone. We need to work together to see that we are able to address these issues. Speaker sir, फॉरेस्टाचो इश्यू घेतल्यार आतांच विजयान सांगल्या प्रमाणे विजय बी फॉरेस्ट मिनिस्टर आशिल्लो. आतां हांव फॉरेस्ट मिनिस्टर जाला, पण एक म्हणजे सगळ्यांक खबर आसा की ह्यो सगळ्यो गोश्टी फॉरेस्टाच्यो इश्यूज ज्यो आहा ते फॉरेस्टाचे इश्यूज आतांच तेणी सांगला की मार्च पर्यंत प्रायवेट फॉरेस्टाचो इश्यू रिजॉल्व जातलो काय ना म्हाका खबर ना, पण आमी ते कंप्लीट करपाचो सर्वे कंप्लीट करपाचो आमचो प्रयत्न आसतलो. एनजीटीन मॅटर आहा, सबज्युडीस आहा, वयल्यान डायरेक्शनां वेगळी येता, पूण त्याच बरोबर स्पीकर सर, वॉट आय हॅव जस्ट मेन्शन्ड इज दॅट परत वागाचेर हांव उलयना. वागाचेर उलयल्यार परत ते कोण तरी मिम्स मागीर तयार करता. ते वाग खंयच्यान आयलो, ते वाग आपल्या कॉरिडोराचेर येता आनी वयता तो, पूण तो वाग हांवें काल संतोष कुमाराक विचारलें, तो वाग आतां तुवें सांगला 25 फावट वाग पळयलो. तो म्हणटा कदाचित तो तोच वाग आसूं शकता. म्हणून हांव तुका पयलींच सांगूंक सोदतां की तो वाग जो आहा, तो वाग आतां दुसरो वाग आहा काय तिसरो वाग आहा तें हांव सांगूंक शकना, पूण ते आपल्या कॉरिडोरांतल्यान स्पिकर सर कर्नाटकाच्यान आनी खंयच्यान ते भोंवत आसता. वागाचो टेरिटरी भरपूर व्हडली आसता. आमचो प्रयत्न कितें आसूंक जाय, पयर बी आमी मिटींग घेतली की आमकां कॉरिडोर हे कॅप्चर करपाक एक ते वागाचो जो कॉरिडोर आहा ते आमी कॅमेरा ट्रॅप्स लावन CSR कडल्यान घेवन आमी एक योग्य तरेन आमकां ते कॅप्चर करून आमकां कळपाक जाय. आनी स्पिकर सर कशें आसता, आमच्या सायडीक बी we have taken it upon ourselves. We have got some fine officers in the forest department, is to see that we create that type of ecosystem. If you want that tiger to stay in that particular area, then that type of ecosystem has to be created. Grazing lands have to be there, cheetal have to be there, whatever has to be done. Like other sanctuaries, we have taken 2 people, Speaker sir, we are onboarding them. One Mr. Luthra, जो पयली higher ranking official आशिल्लो कर्नाटका गव्हर्मेंटाचो, आनी त्याच बरोबर एक मिस्टर रमन म्हणून आशिल्ले, ते बांदवगड आनी ते मध्य प्रदेश केडरचे आशिल्ले, ते रिटायर जाले. ते आमकां ते मदत करूं शकता की कशें फुडें वचूंक जाय. कसलेय गोष्टीक फुडें वचूंक जाय जाल्यार आमकां प्रोफेशनली फुडें गेल्या शिवाय आमी कितेंय हांगा भाशणां मारली काय तेका कांय अर्थ ना. तुमकां पयर आमी उलयताले, चर्चा करताले की फॉरेस्ट डिपार्टमेंट आनी लोकांचें कोएक्झिस्टन्स जावंक जाय. कम्युनिटीक ते एक्टान आहा की दे शूड बी बेनिफीट गिवन टू द कम्युनिटी. सो त्याच बरोबर आनी एक आयडिया आमी काडली. आतां महावीर वायल्ड लायफ सँच्युरीन आमी ते टेंट्स बी नवे घालता. पावस जातकूच थंय नवे पैकी आमी टेंट्स घालून नवे पैकी आमी अरेंजमेंट थंय करून, म्हणजे लोक थंय आकर्शीत वचून थंय वचपाक तरी ते जाय. तांकां हे दिसूंक जाय जंगल ट्रेल्स आसूं काय इको ट्रेल्स ते भितर फॉरेस्ट कोरान ते. आनी दुसरी गोष्ट एक जाल्या विच आय डोंट नो, इट इज एक्झिस्टींग, आय एम टोल्ड फॉर अ व्हेरी लाँग टायम, is that somebody in the High Court, after the High Court has stopped Forest Department from making forest working roads from within the wildlife parks. So you tell me now I have just become Forest Minister. I think it is before CM also was a Forest Minister. These issues, I have told them that they should appeal in the Supreme Court so that you have forest working roads. Otherwise, how will you access the forest? How will you actually exploit that particular area for a good cause? आनी हेच्या खातीर हे सगळे गोश्टी करपाक म्हणून आमी ते मिस्टर लुथरा म्हणून घेतले. ताका फॉरेस्ट मॅनेजमेंट प्लॅनाचेर बी आमी ताका फॉरेस्ट मॅनेजमेंट प्लॅन जो आमचो तयार जाता त्या फॉरेस्ट मॅनेजमेंट प्लॅनार ताका आमकां योग्य तरेचे आमकां गायडन्स तेणी दिवचे. सो दॅट बिकॉज वॉट हॅपन्स इज दॅट इवन इफ यू हॅव टू कट ट्रीज, then you cannot cut trees if it is not mentioned in the forest management plan. Speaker sir, Bondla Zoo we are working on it. We have to work and see that if we are able to do it. I have spoken to Shri Bhupendra Yadavji, who is the Union Minister for Forests. I have spoken to him recently also. He has called me. I have spoken to DG Forest also, who was supposed to come to Goa. what we need to do is to work in a very professional manner in seeing that how we, people of Goa should feel like going to the forest. People of Goa should feel like exploiting or go and have some camps, camping sites should be made available there. ह्यो सगळ्या गोष्टी आमी करपाक म्हणून फुडें सरल्या. So I have made it very clear to DG Forest also and also to Shri Bhupendra Yadavji, told me come with your team to Delhi and I will sit with you and whatever needs to be done, because Haryana kind of a place is going for an international level safari, but that is on a very big scale. Here one park, like leader Mr. Michael Lobo mentioned, that I also cannot see. I have told them, hold on, don't get the tigers so fast. 2 tigers we have already in exchange we are getting. ते वाघाक तुम्ही पिंजऱ्यान घालून दवरले ते कितें पळोवपाक ते मरतले एक दीस. ते काय उपयोग ना ते हाडून. आनी म्हणूनच आमी जे जंगलान जे वयता, हांव बी जंगलान वयता, ते सीएम सोदता केन्ना केन्ना खंय गेला काय म्हणून हांव जंगलान आसता. ते कितें आहा ते जंगलान रावल्यार मागीर ते आमचे वायल्ड लायफ आमचें पॅशन. म्हणून कितें आहा की ओवरऑल आमकां जर कितें बरें करूंक जाय, मुख्यमंत्रीक आमी ऑलरेडी विनंती केल्या की ह्यो सगळ्यो गोश्टी आमकां एक वेगळे तरेन फुडें व्हरपाक जाय जाल्यार प्रोफेशन आमकां खंय तरी कोणी तरी गायड करपाक जाय. हांव मंत्री जालो म्हणून म्हाका कितें कशें फुडें ग्रेजिंग लँड्स कशें करपाचें कशें म्हणून इट्स नॉट प्रॅक्टिकली पॉसिबल. सो वी हॅव टेकन दीज 2 people ऑन बोर्ड. Rajivji, who is our PCCF, Santosh Kumar is there, other young officers are there. We are taking them. And we will sit with the team in Delhi and we'll see how to move forward on these plans. Speaker sir, त्याचबरोबर मुख्यमंत्री कडे चर्चा आताच तुमच्या प्रेझेन्सान आमी जेन्ना केली की हे जे ओवरऑल इश्यूज जे आहा, तरेतरेचे लोक आसता, तरेतरेचे लोक लोकांक भडकोवपाचो प्रयत्न करता. आयज ड्राफ्ट नोटिफिकेशन आयलें म्हणून निलेश कडेन बसून सीएम आमी सगळे आनी आमी वचून ते एक स्ट्रॉंग एक रेप्रेझेंटेशन थंय करपाची गरज आहा की आमचे आतां म्हाजे मतदारसंघ, म्हाजे पूर्ण मतदारसंघ इको सेन्सिटीव जाला. इको सेन्सिटीव जाल्यार ते आमी दोगूय बसून आमी चर्चा करूं शकता. बाबा 20,000 स्क्वेअर मिटराचे तुमी व्हडले टावनशीप तेजे वयर बांदूंक शकना पूण तेजे भितर बांदूंक शकता. हे हांव गांवच्या लोकांक समजूत घालूंक शकना. पूण आमी जो पर्यंत सरकार आहा, आमी लोकां खातीर सरकार आहा. आमी सगळे गोश्टी काय मान्य करूं शकना. खंय ना खंय आयज पयली फावट पब्लीक ऑब्जेक्शना खातीर ओपन केल्लें आसा. पब्लिकान ऑब्जेक्शन करपाची गरज आहा आनी पब्लिकाक आमी सांगतले बाबा ऑब्जेक्शन करा. डिपार्टमेंट कडेन केल्यार मुख्यमंत्री आमी सगळे वचून आमचो व्यू कितें आहा, स्टेट गव्हर्मेंटाचो व्यू कितें आहा की बाबा ह्या इको सेन्सिटीव 99 विलेजीस गोवा हे इतले ल्हान. फाल्यां तुमी म्हाका सांगल्यार म्हाका बडयतले लोक हांगा एसेंब्लींतल्यान भायर सरतकूच. हो विशय घेवचोच पडटा. मुख्यमंत्रीक आमी पयलीं चर्चा केल्या की मुख्यमंत्रीच्या लिडरशिपा सकयल आमी वचून दिल्ली तुमी तुमचो मतदारसंघ बाब सुभाष फळदेचे जे गांव आहा, ह्यो सगळे गांव जे आहा हे मागीर लोक भडकता. मागीर लोकांक आनी कांय दिसना फुडें. लोक म्हणटा पयलींच म्हादय वायल्ड लायफ सँच्युरीचे कांय आउटकम येवंक ना, म्हादय वायल्ड लायफ सँच्युरी कांय फायनल नोटिफिकेशन जावंक ना. आनी त्याच बरोबर हे हांव आयज पयली फावट म्हाका दिसता एसेंब्लीन खूब 22 वर्सां नंतर हांव सांगता की ड्राफ्टाचेरूच आहा. ते आमकां तेचे विचार करचो पडटलो. गोंया राज्यान ते गांवां पयलीं भायर काडपाक लँड एक्वायर करची पडटा. ते लँड एक्वायर करून मागीर तांकां रिहॅबिलिटेट करचें पडटा. खंय आहा लँड गोंयान विलेजीस रिहॅबिलिटेट करपाक. तेन्ना जनरल जॅकॉबान एक दीस रातचे उठलो आनी रंगयले ते आनी रंगयले आमकां बी रंगयले. आमी गेले त्या रंगान. 4 इलेक्शनाचें मतदान जालें म्हणून सालवार, नाल्यार कितें 4 जून 99 हे दीस रातचे आमकां सांजचे आमकां कळ्ळें की नोटिफिकेशन आयलें म्हणून भायर. पब्लीक ऑब्जेक्शन सजेशन म्हणटा ते कांयच घेवंक ना. पूण त्याच बरोबर हावजान हांव NGOक सांगूंक सोदता की 2 रिपोर्ट आहा. आय एम फुल्ली विथ द सेंटिमेंट ऑफ द NGO ऑल्सो, बट सेम टायम पीपल ऑफ द स्टेट ऑफ गोवा एंड पीपल ऑफ आवर कॉन्स्टिट्युएन्सी ऑफ पुअर पीपल who live of this particular area, we need to protect their interest also. And Speaker sir, I'll only take 1 minute on this issue, is that when we are talking about all this, many times it looks very simple, but the issue that is burning there down behind in the village, it becomes very difficult for people like us to control. And as a result of which, we all should be unanimous in the House. It's not only my constituency, but Kasturi Ranga report is only being talked about. माधव गाडगिलाचो रिपोर्ट कुशीक उडयलो. पूण त्याच बरोबर स्पीकर सर तो म्हणटालो की 600 मिटरा वयर तुमी एरिया जी येता ती तुमी वायल्ड लायफ सँच्युरी करात आनी तुमी जे हावजीस घरां बी आहा ती मागीर उरता कुशीक. पूण ह्यो सगळ्यो गोश्टी आमच्या लोकांक खबर आसूंक जाय की कांयच गडबडपाची गरज ना. कारण काय सरकार लोकांचे हिता विरुद्ध काम करचे ना, लोकांच्या हितानूच हे सरकार काम करतले. मुख्यमंत्री आमी बी त्या परिसरात रावता. मुख्यमंत्री सांगूंक सोदता ते इको सेन्सिटिव्ह भिरोंडा आनी पिसुल्ले पर्यंत पावले. फाल्यां मायनींग जर चालू जावंक जाय, फाल्यां लोकांक जाय की मायनींग चालू जाल्ले, हे इको सेन्सिटिव्ह झोन येवन लास्टाक मायनिंगाच्या एरियाक तेकल्यार तुमी मागीर कशें मायनींग त्या एरियान चालू करतले? लोक तसोच उरतलो. म्हणून ह्यो सगळ्यो गोश्टी खंय ना खंय विचार करून ह्यो विशय टेक्निकली आनी एक बऱ्या रितीन ते प्रेझेंट करपाची गरज आसा स्पिकर सर. आनी त्याच बरोबर आमचे अर्बन डेव्हलपमेंटाचेर जायते लोकांनी उलयल्ले आसा. आय ओनली वॉन्ट टू से वन थिंग इज टू श्री विजय सरदेसाय, श्री दिगंबर कामत and others who have mentioned, Shri Daji Sarkar also mentioned, is that we have put up a proposal about 7 years to the government, but it has gone to the government, it has to go under government scrutiny, that we have already put up the proposal for workers who are working over 7 years. And as far as there are several master plans, 4 master plans we have taken up at the moment. And also it is very important that every municipality has its master plan. Speaker sir, I would like to also mention that certain amendments also we are bringing, we'll bring it into the assembly. One is regarding the other day subject which you mentioned, regarding the transfer of that lease and renewal of the shops. The procedure of transfer and renewal of municipal shops is proposed so as to regularize all such transfers, renewals with renewable transfer and regional. And हे सगळे बेसिक जे गरजेचे गोष्टी आशिल्ल्यो ते आमी already घेतल्या. Speaker sir, as far as the municipality is concerned, it's my humble submission in the floor of the house. This is the first time I'm holding. Mr. Kamath is a veteran knows more about municipality than all of us. Vijay is there. All the people representing the municipalities with the concurrence of Honorable Chief Minister, I just want to make a mention, is that all the municipalities now under the 15th Finance Commission, there's a circular that is issued that you have to have audited balance sheets. You have to audit everything. There has to be some sort of an audit carried out even in the municipalities of all the projects that you undertake. You are building projects, but you are not earning revenue out of those projects. You are taking money from the government, but you are not, the municipalities are not doing anything. So municipalities have to earn revenue out of these projects. Then for what have you taken this money? So somewhere the support of the legislators and controlling legislators, whoever you control these municipalities, that we need to find some sort of solution. So after this session, we can sit down once, have a total listing of an MLA is connected with the municipality, and we can call the bodies also and have a brainstorming so that there's an in-between path. It should not look like as though there's a dictation coming from top. There is no infringing on the rights of the municipality, but the municipality also has to follow the directions that has been given. As far as Sansoda is concerned, you have mentioned that Shri Babush Mansarat and waste management, whatever you all have decided, we will concur with that because you all want that it should be done through waste management. We have no issue as far as that is concerned. As far as town planning is concerned, we need to do more of planning. We need to do more of planning rather than doing anything else. Shri Digambar Kamath was the chief minister when the regional plan was formed in the state of Goa. You know the rules and regulations. You actually started that whole thing. I think that paper has gone somewhere. What all points you wanted. So basically, I just want to mention, Bab Yuri Alima also has mentioned whatever points I have noted down, all your points, and I have given it to my people to address them. Whatever issues about the hospital and everything, we have taken on board. Be rest assured, any kind of illegal activity in your area, we will not allow. But second thing, we also have to be a little bit judicious when we do these things. Somebody mentioned to 16B. 16B and 16B पळोवंक बी ना आतां पर्यंत वाचूंक बी ना 16B कितें तें बी खबर ना आनी ते 16B कितें जालां तें बी म्हाका खबर ना. हांवें एकूच निर्णय घेतले की 16B चे अंडर आमी केस घेवचे ना. तुजे जो पर्यंत सबज्युडिस मॅटर आसा ऑनरेबल चीफ मिनिस्टर आसा आमी एकदांच आमची चर्चा जाली कितें करप काय म्हणून हांवें सांगलें आसूं तें आहा तशें सबज्युडिस केस आपण एक लक्षांत घ्या. म्हाका जे केसीस सगळे म्हणटा 7,500 न्हू 6,200 केसीस टोटली आयिल्ल्यो थंय. ना 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 नंबर दिला ते आतां आयला न्ही एसेंब्लीन आयला म्हणून सांगता.
सर
एक मिनिट हांव सांगता नाल्यार हांव आनी कन्फ्यूज
एक स्टेटमेंट काडिल्लो
बरोबर
नंबर मेळ्ळा
ना 6,000 6,200 केसीस जातल्यो. 6,200 केसीस आहा. बेसिकली कितें आहा त्यो केसीस जे कितें आहा आमी आयल्या पळय चेंज ऑफ झोन एप्लिकेशन 16/2022 is 6,211. Okay, so basically number of applications board has taken under section 12 is 1431. Number of cases म्हणजे virtually 1 minute. The total number of cases for which forwarded to the government under section 13.3 of TCP is around 230. ना ते स्पीकर सर आमी टाउन प्लॅनिंगाचे सेक्शन 40 चे अंडर
डिफरन्स मातशें सांग रे 32 आनी 6,200 6,200 खंय आनी 32 खंय आनी सेकंड आय एम नॉट गोइंग टू डू म्हळ्यार यू कांट डू युअर हायकोर्ट इज सेट देर दॅट यू कांट गिव फायनल
ना स्पीकर सर बाब विजय सरदेसाय खबर आहा म्हाजें मत कितें आहा 16B चें 16B हांवें सांगलें हांव हात लावचो ना एक केस घेवपाचो ना जो पर्यंत कोर्ट निर्णय घेना आनी जो पर्यंत कोर्ट निर्णय घेना तो पर्यंत आमकां विचार करचे पडटले की बाबा आमी कितें आनी खंयच्या दिशेन आमी वयतले. पयलींचे स्पीकर सर झोनींग प्लॅन आशिल्ल्यो सीएमाक खबर आहा आय डोंट नो इफ सीएम इज अवेर बट झोनींग प्लॅन आमी एक झोनींग प्लॅन्स आशिल्ल्यो गांवांत झोनींग प्लॅन जातल्यो आनी ह्यो झोनींग प्लॅन्स परत एकदा एक्टिवेट करपाची गरज आसा. सॅटेलायट टाउनशीप तुका
स्पीकर सर आतां आमी वॉट एवर वी डू वील हॅव टू डू इट अंडर द एक्ट. अंडर द एक्ट रिजनल प्लॅन इज द all encompassing act, the plan. Regional plan आता 2021 आहा. मुख्यमंत्र्याच्यान 2031 करूं येता. प्रोविजन ताका आसा. पूण तें कितें आहा ती चड सगळें हें तें वचून कन्सल्टेटिव्ह प्रोसेस म्हणटा तो तकली दुखपाचो. तें रानान वचपाक बी मेळचें ना मागीर.
रानान गेल्यार ते विचार बरे येता तकलीन म्हणजे व्यवस्थीत येता म्हणजे ग्रीनरी भरपूर दिसता ते म्हणून म्हणटा हांव ना हे आमकां वऱ्या सगळ्यांक पूण मेन म्हणजे स्पीकर सर की हे जे सबज्युडिस मॅटर 27-28 सारखे कोर्ट केस आहा हांव एसेंब्लीन हांगा स्टेटमेंट करून फाल्यां हेडलायन आयल्यार आनी बलते जातले. आमकां व्यवस्थीत सगळ्या स्टेक होल्डराक व्यवस्थीत बरोबर घेवन आमकां योग्य तरेचे विचार करचे पडटले. बेश्टे हांवें कितेंय स्टेटमेंट म्हणून इरिस्पॉन्सिबली हांव दिवंक शकना. तुजे सेंटिमेंट्स कितें आहा ते समजून घेतले हांवें पूण त्याच बरोबर एवरी मेंबर वील अग्री दॅट इट इज ऑलरेडी देर ऑल ऑफ अस नो वॉट इज द थिंग एंड सेम टायम आमचे सगळे तिनी PDAचे चेअरमन्स जे आहात तांकां बरोबर घेवन आमी जे कितें केल्या जे कितें करपाक जाय. स्पीकर सर RP 21 चो आर्किटेक्ट बाब दिगंबर कामत RP 21 तर तेका विशय विचारल्यार ते ही वील आन्सर यू स्ट्रेट अवे दॅट यू कॅनॉट मेक एनी चेंजीस एज फार एज RP 21 is concerned into any other zone. You agree with me? So basically, no, I'm not asking about the definition of act. No, Mr. Kamath, I am just saying that I just said.
Any changes. The development, each and every development shall be in conformity with the regional
plan 21. So regional plan 21 चे conformity in सगळे
Because
गोष्टी जावंक जाय.
the Honorable Minister is talking of regional plan. What do you have to say about these ODPs being open every time there's a new chairman appointed?
Welcome. Speaker sir, today we have to understand one thing is that we have to work in a very judicious fashion. Whatever, there is no particular any single individual or double individual or triple individual. Here we have to see that illegalities are looked at seriously. As a result of which, our chairmans are there, Madam Jennifer Monsarat is there, Bab Daji Sarkar is there, there's a young chairman from Marmogan, Joshua. They will sit down independently and with full authority, they will decide what, along with the consultants and other things, and whatever had to be corrected has been corrected within the section 40 and within section 132. ते कितें धाडूंक जाय ते जबाबदारी त्यांची असतली. कन्सल्टंट आमी तुमी सांगला सजेशन जे दिल्या त्यो सजेशन एंड कन्सल्टंट ना they are there. I will take them into. तुम्ही जे सांगता ते बरोबर आहा. But also we must remember आम्ही सदा म्हणटा फक्त किर्लोस्कर कन्सल्टंट आम्ही म्हणटा. Kirloskar consultant is not the only consultant that is there, but there are different, you'll be shocked. There are some people came to give a presentation, Speaker sir. Young people who are there, who are on board, who are actually out of Columbia University and all who are here, they have to do, and Forest Department is there only. We have to work in tandem. You just mentioned that these open spaces which are there, to be handed over to these local bodies as per this. So I will sit with the CTP and I will find out and give them strict instructions that wherever the local, whether it is the panchayat, whether it is the municipality, they have to work in independence, they have to work with full authority. All the chairmen will be responsible for whatever the ODPs and corrections and all have to be done. I will take them on board. We will work together. And I can assure you, Speaker Sir,
Speaker sir, my demand is not there. My demand is that once you finalize your ODP, freeze it for a particular period of time.
I have not
Don't
finished.
change it every day.
I have not forgotten your question. So what Alex Sirkar म्हणटा ती सारखी गोष्ट. म्हणजे तो म्हणटा कितें की नवो चेअरमन आयलो की ताबडतोब नवी ODP जाता ते बरें आहा. पण तुमकां एक गायडलायन तुमी जे सांगला ते सारकी गोष्ट की एक टेन्युअर आसूंक जाय की ODP एकदां केली की त्या टेन्युअरान मागीर ते फ्रीज जावंक जाय फॉर दॅट पर्टिक्युलर पिरियड. So give us whether it is for 2 years or whether it is for 3 years. ना राव एक मिनिट हांव उलयतां.
मंत्र्याचे म्हजे लक्षांत हाडूंक सोदता की ODP म्हणटा ते ATM जाल्लें आहा. इलेक्शनाचे पयलीं ODP ओपन जाता. आतां नवो टेन्युअर जावन परते दुकान उगडें करता. पूण सदांच जर पळयलें जाल्यार थंय ताका एक हॉरायझन पिरियड आहा. हॉरायझन पिरियड 10 वर्सांचो आहा. सो ODP ओपन कित्याक जाता आतां मदीं मदीं आनी केल्ल्यो ODP 10 वर्सां खातीर केल्या न्ही.
स्पीकर सर,
त्यो खंय गेल्यो?
स्पीकर सर, हांव आयज बाब विजय सरदेसायाक सांगूंक सोदतां, हांव हांगा एसेंब्लीन कोणाशें ताशे मारपाक काय उबो रावूंक ना. हांव आतां एज इट इज 8:30 जाली मागीर वचपाचो टायम जालो आतां. पण एक खंय तरी जाय ते मनीस उलोवंक शकता, जाय ते करूं शकता. काम करून दाखयल्यार बरें. गोंयचे जनतेक खबर आहा कितें जालां, गोंयचे जनतेक खबर आहा की कितें करूंक जाय, गोंयचे जनतेक खबर आहा की खंय कितें करेक्शन आनी इलिगॅलिटीज केल्यो ते आमकां इको सेन्सिटीव झोन आसूं काय तुमचे नॉन डेव्हलपमेंट स्लोप आसूं काय सॉल्ट पॅन आसूं आमी ते काय कन्वर्ट करूं शकना. ह्यो गोश्टी इको सेन्सिटीव एरियाच्यो ज्यो गोश्टी आहा जेन्ना म्हाजे नजरेक येता आनी हांव मंत्री आहा, म्हाजे कडेन कायद्या प्रमाणे एक क्लॉज आहा, त्या क्लॉजा प्रमाणे हांव काम करतलो. म्हाका मुख्यमंत्री जो पर्यंत म्हाजेर विश्वास दवरता की बाबा हो कितें पिशेपणां करचो ना, योग्य तरेचे गोश्टी करतलो, त्याच तरेचे गोश्टी आमकां करून फुडें वचूंक जाय. तोंड हा आमकां सगळ्यांक, आमी कितेंय उलोवंक शकता. पण हांव उलोवपाक हांगा विधानसभेत एक जबाबदारीची कामां आमकां दिल्ली आसा. जबाबदारीन आमकां काम करूंक जाय. जबाबदारीन आमकां कितें आमी उल्लेख केला आनी जे जनतेक आमी आश्वासनां दिल्या की इल्लिगॅलिटीज म्हणटा ते सॉल्ट पॅन, नॉन डेव्हलपमेंट झोन, इको सेन्सिटीव झोन. आतांच बाब दिगंबर कामत जे गोंयचे तांकां अनुभव खूब आहा, तेणी सांगलेलें आसा की RP 21च्या गोश्टी तुमी चेंज करूं शकना. दॅट इज द बॉटम लायन ऑफ द होल थिंग. सो बेसिकली ह्यो सगळ्यो गोश्टी ज्यो जाल्या ते आमी करेक्शन केल्ले आसा. ते करेक्शन केल्ल्यो गोश्टी तुमकां हावजान सांगता, परत आनी ते करेक्ट जावचें ना. जे जावंक जाय करेक्ट ते आमचे चेअरमॅन मॅडम जेनिफर मोन्सेरात ती आसतली. तिका जाय तो कन्सल्टंट ती घेवं शकता. तिचे बरोबर काम करून आमी हे हावजाक आश्वासन दिता की ट्रान्सपरंटली आमी काम करतले. त्या सायडीक दाजी साळकर आहा, ह्या सायडीक जॉशू आहा, आमी करतले. पण जर कोणाक दिसता की हांगा कोण तरी येतलो आनी कोण तरी गडबड करतलो, कोण तरी बदल, म्हाका कोणाचेच काय पर्सनल ना हांगा. हांव एक सांगूंक सोदता की जे सॉल्ट पॅन्स आनी ह्यो सगळ्यो गोश्टी ज्यो जाल्ल्यो, दोंगर जे जाल्ल्यो, ही म्हाजी जबाबदारी आशिल्ली आनी हांवें ठरयल्लें हांव जाय जाल्यार वेगळे तरेन वागूंक शकता आसलो. पूण कितें आहा की म्हाका बी कांय गोश्टी, म्हाका बी कांय जबाबदारी आसा आनी जबाबदारीच्या आदाराचेर म्हाका गोंयचे जनतेक लेट डावन करपाची गरज ना. आनी म्हणूनच स्पीकर सर आतां एकूच सांगपाचो मुद्दो इतलोच की आमचे चेअरमन्स जे आहा हे चेअरमनाक पूर्णपणे ऑथॉरिटी दिवन आनी तांकां तेंची मिटींग फाल्यां नाल्यार परवा घेतलो. म्हाजे जे कितें तांकां सहकार्य लागता ते सहकार्य तांकां दिवपाचो म्हाजो प्रयत्न आसतलो. पण ते पूर्णपणे आपली ऑथॉरिटी चलयतले, पूर्णपणे तांकां कितें करेक्शन करूंक जाय करेक्शन आमी जें केलां तांकां समजूत आमी घालतले. आमचे ऑफिसर बरें काम करता. ऑफिसराक बी केन्ना केन्ना मान दिवपाची गरज आहा. आमच्या डॉक्टराक कशें आमी मान दिता तशेंच टावन प्लॅनिंग डिपार्टमेंटाचे ऑफिसर बी बरे ऑफिसर आहा. तांकां आपलें काम करून दी. तांकां कितें करूंक जाय ते योग्य तरेन रिस्पेक्टफुली. ऑफिसर आमचे फॉरेस्ट डिपार्टमेंटाचे ऑफिसर आहा. हांव केन्नाय खंयचे ऑफिसराक वयर सकयल केन्ना एक रिस्पेक्टफुली आमी वागल्यार पयर हांव एक सांगूंक सोदता हावजान आमी दोगूय आशिल्ले. मुख्यमंत्री हांव आशिल्लो. प्रधानमंत्रीन सांगलें की आपल्याक बी खूब गोश्टी आयकूंक येता. आपल्याक बी खूब गोश्टी आयकूंक येता की बाबा 4 जाण एडवायस करता पूण आपूण राज्य चलयता आनी ह्यो सगळ्यो गोश्टी जाता. आनी प्रधानमंत्रीन सांगलें काल आमी आशिल्ले आमी आयकताले कि बाबा ये देश जो चलता है ये ब्यूरोक्रेसी के साथ चलता है, ऑफिसरों के साथ चलता है, आप लोग उनके साथ काम करना सीखो, नहीं तो कुछ कर नहीं पाओगे. आम्ही बी तेच धोरण घेऊन आमकां फुडें वचूंक जाय. आमी जे प्रधानमंत्री सांगता आमी थंय वचून बेश्टे टायमपास करपाक वचून आमचे लिडर जे सांगतात ते करपाक पूण आमी बसले. हे ऑफिसरांक मान दिल्यार ते ऑफिसर काम करतले. आनी म्हणूनच हांव आनी फुडें वचना जे इलिगॅलिटी जाल्या हावजान एक आंकडो दवरता एक 16 लाख पर्यंत स्क्वेअर मिटर जमीन जी आमी रिवर्स केल्या त्याच बरोबर जे खंय इलिगॅलिटी करूंक जाय ते इलिगॅलिटी जे केले गेले ते इलिगॅलिटीज म्हणटा स्पीकर सर. हावजान आनी चुकीचो शब्द रेकॉर्ड जावन उपयोग ना. इलिगॅलिटी जे केले जे कोणी केले कितें केले ते म्हाका सांगपाचें ना हांगा. कोणाचेच पर्सनल म्हाजे कांय ना, पूण एक शब्द मात तुमकां आयज दिता हांव ह्या हावजान की जे कितें रिवर्स जाला ते परत आनी रेकॉर्डार येवचें ना. ते रिवर्स जे जाला ते रिवर्स जाला, गोंयचे हितान रिवर्स आमी केल्या. हे भारतीय जनता पक्षाचो सरकार आनी हांगा आमकां स्वताक विकपाक आमी येवंक ना. आमी ऑन सेल ना आनी आमी जे कितें निर्णय घेतला तो निर्णय आमचो कायम उरतलो. आनी मुख्यमंत्री बरोबर काम करून फुडले 5 वर्सां योग्य तरेन आमकां जबाबदारीन आमकां पावला फुडें व्हरूंक जाय. इतलेंच सांगून म्हजे 2 शब्द पूर्ण करता. देव बरें करूं.
Yes.
The raised issue of Shri Alex Sequeira is that I will write to you within the next 3 days. Let me sit with them also, but you have my word. It should be at least for 3 years once they finish the ODP and the whole process.
Speaker sir, you can't plan for 3 years. It's a farce.
Amendment to the act.
Alex, I need one minute.
You can't amend the act.
आयज हावजान म्हाका जर अमेंडमेंट करूंक जाय तो म्हणटा 10 वर्सां.
ना आसात ते,
Ashil law, it is in
बरयल्या.
the act. You don't have to amend.
एक्टान जे कितें आहा एक्टान ऑफ हे करूं शकना, पूण म्हाका मातसो वेळ जाय. तुमी जे सांगता आय अग्री विथ यू ऑन द फ्लोर ऑफ द हावस.
If it is in the act for 10 years, you will stand by it.
I
Because
don't
it
think.
is in the act. We know the
एक मिनिट.
And 10 years we know.
एक मिनिट विजय, एक मिनिट. स्पीकर सर, 10 वर्सां असले तरी बी 5 वर्सां नंतर ज्या तरेचो प्रेशर येता हांगा, ज्या तरेचो प्रेशर एक 5 वर्सां खातीर म्हाका एक तूच सांग म्हाका. प्रेशर ऑन डेव्हलपमेंट शूड हॅपन ऑर वी शूड ओनली स्टॉप डेव्हलपमेंट.
स्पीकर सर, असो आहा आदले प्लॅन जाल्ले आतां रिवायंड करता आमी. ते फुडलो प्लॅन जाला तो 10 वर्सां खातीर प्लॅनिंग म्हळ्यार कितें विथ फ्युचर इन मायंड न्ही. हाऊ कॅन यू प्लॅन फॉर प्रेशर?
स्पीकर सर,
स्पीकर सर हाजेर प्रेशर घेऊ नाका म्हणून चड.
आता एक मिनिट स्पीकर.
हेल्थ मिनिस्टर डोंट टेक प्रेशर.
ना, ना.
जुवारीचो बी प्रेशर आहा तुजो?
हांवें जुवारीचें नांवच घेवंक ना.
ना जुवारीचो बी प्रेशर आहा तुजे?
म्हाका कोणूच येना.
दॅट इज ऑल्सो पार्ट ऑफ द प्लॅन.
आयक स्पीकर सर, जुवारीचो जो विजेचो कितें विशय आहा तो वेगळो विशय आहा.
अरे विजयचो विषय न्ही तो.
ना, तुवें
गोंयचे
विशय
जनते
मांडला, म्हाका
तूं इंडस्ट्रीज मिनिस्टर म्हणून उलयता
अरे
तुवें.
बरोबर, TCP मिनिस्टर म्हणून उलयता हांव. विजयान जे विशय मांडला तकली ना, पूण कितें आहा की तो विशय वेगळो विशय. जो एलेक्स सांगता तो वेगळो विशय. आसगांव विलेजान 5 वर्सां काय 10 वर्सां पयलीं कोणाक जमीन जाय आसली ती? There was nobody. Asagaon, nobody wanted to go there. Nobody wanted to go to Moira. Nobody wanted to go to these places. Today, COVID is, 1 minute.
Sir, then you got section 16.
No, listen. Who has told you that I am good? I can't even make a statement because the hearing is on 27, 28, and you know it. You're provoking to me to get caught in my own web. So I don't want to get caught in that web. That said, Vijay is there. Vijay knows what my thought process is on 16B. I have already made it clear that 16B, what is 16B? I have already taken a decision that all those cases will be scrutinized. Those 6,000 cases, so don't talk only. They have nothing to do with us. It's only the 1,000 cases. Unnecessarily, we are creating a hype of these 7,000 cases. Those 6,000 cases will not be considered at all. That's my word to you in the House. But same time, zoning plans also are required. When the satellite, when you see satellite, yesterday I was talking to Sudhin Dawdekar. He said, my area in periphery, one minute.
I'm not saying don't do a fresh zoning plan. If you feel the need is to do a fresh zoning plan,
So as and when
do
required.
it. But my submission to you is,
My thing
that
is,
once you do it, freeze it for a particular period of time. This is
because
my request.
माझे मत असे हा की TCP Act says that at least once in 10, 1 minute, I am reading the line. TCP Act says at least once in 10 years ODCP to pay. It does not say I can't revise it twice. So any, one minute. Rao re, Vijay, kide te? Speaker sir, TCP Act, I am reading just what is been given to me. TCP Act says at least once in 10 years, ODP should be revised. So any number of times and no restriction. Today in the house I will tell you that once in that 10 years चे सोडून दिया, once in 10 years no, 5 वर्षान एकदा ODP केल्यार पुरो. पण ते बी हांवें तांकां सांगलें एक मिनिट हे जे कितें आहा हे एमेंडमेंटाक आमी घालता कित्याक एक 1 minute let me just I can't unilaterally take I must take my chief minister also I can't just take unilateral stand here. And second thing is that my authority chairmen also there, so I have to ask them. So let me give you assurance that if it requires amendment, we'll put it for amendment. But let me just speak to the chief minister once and put it to the cabinet and then take it forward. But we will take whatever I have assured you today before the next assembly session. We will give clarity on this.
It's okay.
No. I don't want to say anything, but so basically we will take a call accordingly jointly on what we want to do on this thing once in 5 years or once in 10 years. या ऍक्ट प्रमाणे 10 वर्षांनी कितले फावट तुम्ही करू शकता असा गरज ना मॉडिफाय provision is there. So basically let them also take see Alex
मिनिमम वन्स इन अ 10 year त्याच्या मदीं इफ सरकाराक जाय आसत जाल्यार करू शकता
CM sir, the issue is basically
म्हणते
ना ते स्पीकर सर
10 वर्षांनी एकदा
स्पीकर सर हांव एक सांगूंक सोदता
वर्साक दोनदा जाय तशें करूं येता once in 10 years न्ही every 6 months you can do it.
सर हांव विजयाक सांगूंक सोदता विजयाक खबर आहा की हांव ATM मशीन तो ATM आसूं येत पूण हे जर पयशी जाल्यार हांव ATM न्हू हे जे पयशी जाल्यार हांव ATM न्हू आनी हांगा गोंयच्या जनतेच्या नांवार पयशे करपाक येवंक ना आनी ते ATM म्हणून ते जाले काबार ATM हांगा कोणूच ATM ती बी ATM ना हांव बी ATM ना तो नवो आहा तो ATMूच न्हू तो यंग डायनेमीक आतां जाला पूण एक लक्षान घे ATMचो शब्द हांगा आमचे कडेन ऑपोजिशनान जायते लोक आहा एंड यंग अशे डायनेमीक वेन्झी आसा विरेश बोरकर आसा हे केन्नाय जर दिसता तांकां तूं आसा केन्नाय दिसता जाल्यार आमी कितें चुकता आमचे नजरेक हाडून दियात there is no issue we are going to follow it very transparently and whatever we do we'll do it transparently sir. And with this I would like to conclude and I would like to once again speaker sir mention to the honorable members that please drop a note so that I can address all the issues independently. Thank you.
Regarding the Kadamba plateau, तो एक क्वेश्चन विचारलो Kadamba plateau जो FIR वाडयलो तो.
Speaker sir, I'll clarify. FIR वाडोवपाचो विशय येऊ शकता चर्चेक येऊ शकता. दोन गोष्टी हांव विसरलो सांगपाक तुजे एक TDRचो विशय आनी तुजो कदंबा प्लॅटोचो हेजो अर्थ ना की खंयी आमी FIR दिवं शकता दिवपाचें कांय ना कांय एक चर्चा जाली आमी सांगलें there is a body that is being formed that will be under we'll take all the authority people together plus us we will decide where the rules regulations have to be formed speaker sir only then we'll decide as far as TDR is concerned you have to find out first the sending areas then the receiving areas तेका रूल रेग्युलेशन करचे पडटा त्याच बरोबर स्पीकर सर हांव विसरलो सांगपाक बिल्डिंग एक आमी थरयला आनी आमकां घेवंक जाय मुख्यमंत्री ब्रीफ करतलो हांव त्याच की आयज बिल्डिंग्यो जे आहा ते पार्किंग सगळी कडेन पार्किंग रस्त्यार करता डबल स्टील पार्किंग केल्यार एम्युनिटीज ना आयज लोकांची राहणीमान सुदारल्या वेगळ्या तरेचे लायफस्टायल चेंज जाल्ले आसा बाथरूम्स नासता खंयचे बिल्डिंगेक ह्यो सगळे रुल्स रेग्युलेशन्स आमी योग्य तरेन आमी फुडें व्हरपाचो आमचो प्रयत्न करतले तुमकां जर दिसता की 4 FII म्हटलें म्हणून सगळी कडेन 4 घातले तशें कांय ना ते तेजेर कांय फायनलायजेशन जावंक ना
Yes.
आनी एक लास्ट स्पीकर सर की हांव मातशें सांगूंक सोदता की तुमी जे उलयता आमी सगळे म्हणटा रिजनल प्लॅन तो रिजनल प्लॅनाचो भुताचे म्हाका केन्ना केन्ना भंय दिसता की रिजनल प्लॅन म्हणटा ते रिजनल प्लॅन ते पण मेन म्हणजे स्पीकर सर की आनी एक आहा की फार्म हावस पॉलिसी बी तेजेर खंय तरी चर्चा करपाची गरज आहा लोक आयज पयलीं सारके उरोंक ना farm house policy was initiated by my father earlier on and then it was changed again. So that's why we are coming out with a farmhouse policy. It is beneficial to the people of the state of Goa. आणि तुम्ही करा त्याचा फायदो घेतल्यावर काय हरकत ना. आणि ह्याच तरेन आमकां फुडें वचूंक जाय. एंड तुमचे जर मनान जर कितें सजेशन असले फॉर अ मॉडर्न गोवा एंड अ मॉडर्न डेव्हलपमेंट करपाक एक वेगळ्या तरेन तुमी सजेशन करपाक काय हरकत ना.
स्पीकर सर, मिनिस्टराक विचारपाक सोदता हांव ताका क्वेश्चन केलेलें. आमचो मार्केट प्रोजेक्ट जो सड्याचेर आसा 1.5 वर्स जालें सर इनॉग्रेट.
तुका असेंब्ली जावपाचे पयलीं आमी मिटींग घेवया हांगाच. कितें जालां कितें आहा तें रिव्यू घेवन सीओ आपूण सगळें कितें आहा तें करुया आमी.
आणि pediatric neuro rehab in South Goa District Hospital, assurance on the floor of the house.
Yes.
And toilet at AWS Seraulim आणि मोबर GPS.
ते म्हणून तुका सांगलें मातशें एक ड्रॉप अ नोट सो आय कॅन. आता तुम्ही सपोर्ट करूंक जाय.
Speaker sir, the Honorable Minister has not told us what is the fate of those 9 people whose services are being terminated.
I have taken your view and done what I have to do. So you should be happy with that.
Doing a good job. 15 staff आहा. तांकां कन्फर्म करपाचो. I think that assurance if you can give, because you yourself are in concurrent that they are doing a good job and it is something very unique for Goa. If this house can get this assurance that they will get a permanent stature, I think this is the best time.
I didn't understand. Just tell me once more.
15 staff आहा GMC cardiac into. So they are not permanent.
ते आम्ही केलं ते. We are giving them the salary on par, but wherever the relaxation, we are doing our best to see that we observe. We have to give them. They have worked extremely well.
Very well.
And we are doing that. And आणि एक तुझे ते ODPचे सांगता स्पीकर सर.
permanent
ODPचे आता उरलेले नाही. आमचे चेअरमन हा मॅडम थंय बसल्या आणि हांगा तिगय बसल्या. तांकां घेवन आमी पब्लिकाक दिला खंय कितें चुकला बिकला जाल्यार 60 दिसा भितर आमकां सांगपाक ते थरयतले कित्याक.
So you are going to get them permanent stature.
Yeah.
Okay, permanent stature.
Alton सांग.
अरे permanent.
एक्सक्यूज मी एकूच सांगता होते म्हाकाय विशय खबर आहा म्हणून सांगता तांकां रेजिडेंटाचो प्रॉब्लेम आसा. फॉर रेजिडेंट ताका एट पार सॅलरी दिवपाक मिनिस्टर एग्री जाला फाटले फावटी. एट पार सॅलरी विथ द आवर नर्सीस तसो हा विशय तो. ताका फक्त रेजिडेंट इश्यू आसा तितकोच. बट एट पार सॅलरी विथ द गव्हर्मेंट स्टाफ.
WhatsApp.
Not got an answer. In Gaonkargado, 5 lakh square meters, where 500 plots have been.
पहिले म्हणजे हांवें ऑलरेडी तुझी माहिती घेतली पयली. They cannot do out and out subdivision of these plots.
Yeah.
So you drop me the survey number. CTP will send a team and check
I've
it.
already mentioned, but I will give it to
ना
you.
म्हाका एक WhatsApp धाडल्यार पुरो. फाल्यां पर्यंत हांव करता बंद.
Yes, sir.
One health center that I had asked in Kunkolim, if
Kunkolim requires, because you are sharing between Kepe and Kunkolim. So we will take it up. Lotlim also, Honorable Alex Sequeira had asked that he is a non-bedded actually thing. Because आणि एक गोष्ट कितें आहा की आयजची परिस्थितीन सगळी कडेन आमी काय वाडपाक गेल्यार आमचे कडेन सांबाळपाक बी एज इट इज डॉक्टराची कमी आहा. आनी म्हणून आयज बाब निलेश काब्राला तेजे उद्घाटनाक तो रावला. ते केन्ना आपले जातले म्हणून उद्घाटन तेजे इतलें उरलां काम थंय. म्हणजे फ्रॉम स्टाफ टू एवरीथींग. But I can assure you, because you need, and as far as Alex is concerned, he is to be refurbished, and we will see what we need to do.
चर्चा खूप जाल्ली आसा. हांगा थांबुया आमी. चर्चा खूप जाल्ली आसा.
I'll give you a new medical officer.
Yes. उलय. प्रेस बटन.
बालवाडीच्या बद्दल फक्त आमची जी बालवाडी आसा जी ओल्ड गोवा ते सारके बॅड कंडिशनान आहा. त्याच्या बद्दल मातशें आमकां जाता तितलें बेगीन हेल्प करचें. कारण क्रॅक गेल्ले आसा. व्हडले क्रॅक पडल्या.
ना तुजें पूर्णपणे ऐकला.
येस.
तुझे सेंटराचे पासून सांतिस्ते पासून दिवार पासून सगळे कडेन भोंवून आयला तुजे कॉन्स्टिट्युन्सीन हांगा व्हर्च्युअल. आतां फिजिकली येता तुज्या बरोबर डायरेक्टर बसल्या फाटल्यान. तिका सांगता तुका फाल्यां कॉन्टॅक्ट कर म्हणून. आनी तुजे स्पीकर सर ऑनरेबल मेंबराचे कितें विशय आहा
बरें चर्चा खूप जाल्ली आसा.
Thank you, sir.
फुडली काम अरे
If you can give this assurance,
because sir, I already forest departmentचे आमचे APCCF कडे धाडला. थोडो टायम म्हाका दी ते विचार ते कशें सॉर्ट आउट करपाक.
स्पीकर सर, म्हाका एक एश्युरन्स संजय दियावेर हेल्थ सेंटर तिंगा सर्वीस सामकी पुअर आहा.
सब हेल्थ सेंटर न्ही सब हेल्थ सेंटर काय कितें
प्रायमरी हेल्थ सेंटर कितें जाय थिंगा कित्याक थिंगा सब सेंटर ना थिंगा इम्प्रुवमेंट जाय
हांव वयता आनी पळयता मेंबर वांगडा पयलीं
थिंगा सामकी नेसेसिटी आहा आतां कित्याक सर इंडस्ट्रियल स्टेट आहा क्रॅशर्स आहा सोगटे आमकां कुच्चोरी वचपाक पडटा.
क्रूज बाब हांव तुज्या वांगडा येवन पळयता लेट्स एसेस एंड देन वील ब्रीफ चीफ मिनिस्टर.
जस्ट थँक्यू.
येस
मातशें कंडक्ट करपाक आफ्टर हें आतां सद्या मातशें पेशंट चड आहाय मातशें पेशंट चड देंवले काय ना हें पेशंटाचें चड मातशें आतां येता मातशें चड प्रॉब्लम आहा. कॅन्सर चॅकींग कॅम्प्स मातशें कितें जाल्यार ट्राय सम कॅम्प्स.
स्पीकर सर आमचे ऑलरेडी ब्रेस्ट कॅन्सराचे चालू आहा आनी एक
Villages,
कंपनी आयिल्ली
constituency wise, village wise,
आनी
in the city, go down to the people.
आनी एक आयिल्लें आसा सुरवातीक आमी महिलाच्यान आमी करता सर्वायकल कॅन्सरा खातीर ते पॅप स्मियर आनी सगळें करपाक हांव करून घेता तो सांगता तशें.
येस
सांगलें न्ही
आता वळेरी क्रमांक 4 आयिल्ल्यो मागण्यो क्रमांक 47, 48, 49, 51, 53, 54, 55, 58 आणि 68 वयले कपात सुचोवणी कट मोशन्स सभागृहाच्या मतदानात घालता. जांकां त्यो मान्य आसा ताणें हय म्हणचें, जांकां ना म्हणपाचें आसा ताणें ना म्हणचें. ना मंडळाचें म्हणणें मान्य जालें, ना मंडळाचें म्हणणें मान्य जालें. कपात सुचोवण्यो नामंजूर जाल्यो. आतां हांव वळेरेक प्रमाणे दिसाच्यो मागण्यो क्रमांक 47, 48, 49, 51, 53, 55, 54, 58 आणि 68 सभागृहाच्या मतदानात घालता. जांकां त्यो मान्य आसा ताणें हय म्हणचें, जांकां मान्य ना ताणें ना म्हणचें. हय मंडळाचें म्हणणें मान जालें, हय मंडळाचें म्हणणें मान जालें. मागण्यो क्रमांक 47, 48, 49, 51, 53, 54, 55, 58 आणि 68 मंजूर जाल्यो. आता भौशीक बांदकाम खात्याच्या मंत्र्यांनी योग्य गोंय उदका पुरवण तरतूद दुरुस्ती विधेयक 2022 सभागृहांत दाखल करून घेवपाचो थाराव मांडचो. मंत्री.
Speaker sir, I request leave to move the motion to introduce bill number 7 of 2022.
प्रश्न असो आसा
The Goa Provision of Water Supply Amendment Bill 2022.
येस प्रश्न असो आसा गोंय उदका पुरवण तरतूद दुरुस्ती विधेयक 2022 मांडपाक अनुमती दिवची काय कितें. जांकां तें मान्य आसा ताणें हय म्हणचें, जांकां मान्य ना ताणें ना म्हणचें. हय मंडळाचें म्हणणें मान्य जालें, हय मंडळाचें म्हणणें मान्य जालें. विधेयक मांडपाक अनुमती दिल्या. मिनिस्टर.
Speaker sir, I introduce the bill.
गोंय उदका पुरवण तरतूद दुरुस्ती विधेयक 2022 सभागृहांत मांडल्या. गोंय वित्तीय लागणूक आनी अदमासपत्र व्यवस्थापन दुरुस्ती विधेयक 2022. चीफ मिनिस्टर. मंत्र्यांनी विधेयक मांडपाचो प्रस्ताव मांडचो.
Sir, I request to move that the bill number 6 of the 2022 Goa the Fiscal Responsibility and Budget Management Amendment Bill 2022 be taken into consideration.
प्रश्न असो आसा विधेयक विचारांत घेवचें, जांकां तें मान्य आसा ताणें हय म्हणचें, जांकां मान्य ना.
स्पीकर सर, पॉइंट ऑफ ऑर्डर. मुख्यमंत्र्यान लास्ट टायम हे इंट्रोड्यूसच करूंक नासलें, फक्त निलेश काब्राल धाडलो आमी बोवाळ करतना.
ना बिल इंट्रोड्यूस केला ताणें केला बिल पी ताणें केला इंट्रोड्यूस केला.
फायनान्स मिनिस्टर केलो ताका
ना ताणें इंट्रोड्यूस केला. बिंग अ लेजिस्लेटिव्ह मिनिस्टर ताणें इंट्रोड्यूस केला.
येस प्रश्न असो आसा विधेयक विचारांत घेवचें.
One second. When you are taking for consideration, you at least tell the house no what the purpose of bringing.
पासिंगाच्या वेळार उलयात न्ही.
आमकां उलोवपा नाका.
कन्सिडरेशनाकूच उलोवप आसता.
What we said is you at least tell the house at least what is the purpose of bringing this so that everybody knows.
Yes.
सर हे बिल जे आमी घेता आमची लिमीट जी आसा it is from the it is recommended is 4% of the GSTP. पयली 3.5% आशिल्ली 3 to 4%चेर गेला, which is a borrowing limit has increased to the 3,600 crores. आणि आमी जरी इतकी 3,600 crores borrowing limit जरी असली इतकी आमी कन्सिडर करतले तशें ना. फाटले फावटी आमची borrowing limit 3,280 crores आशिल्ली, आमी 2,500 फक्त बोरो केल्ले आसा. दॅट इज देट. आनी कितें
प्रश्न असो आसा विधेयक विचारान
एक
घेवचें.
ऍड करता फक्त आतापर्यंतचे आम्ही बोरो जे आसा 4 महिने फक्त 100 crores केले.
प्रश्न असो आसा विधेयक विचारान घेवचें जांकां तें मान्य आसा ताणें हय म्हणचें, जांकां मान्य ना ताणें ना म्हणचें. हय म्हणटाचें म्हणणें मान्य जालें, हय म्हणटाचें म्हणणें मान्य जालें. विधेयक विचारान घेवपाचो प्रस्ताव मान्य जाला. हांव त्या विधेयक कलमवार सभागृहांत सादर करतां. विधेयकाक दुरुस्त्यो नात. प्रश्न असो आसा कलम 2, कलम 1 अधिनियम सूत्र आनी प्रदीर्घ मथळ्याचो विधेयकाचो भाग जावचो काय कितें. जांकां तें मान्य आसा ताणें हय म्हणचें, जांकां मान्य ना ताणें ना म्हणचें. हय म्हणटनाचें म्हणणें मान्य जालें, हय म्हणटनाचें म्हणणें मान्य जालें. कलम 2, कलम 3, कलम 1 अधिनियम सूत्र आनी प्रदीर्घ मथळ्याचो विधेयकाचो भाग जाल्यात. मुख्यमंत्र्यांनी आतां विधेयक मानून घेवपाचो प्रस्ताव मांडचो.
Sir, I request to move that the Bill number 6 of the 2022, the Goa Fiscal Responsibility and Budget Management Amendment Bill 2022 be passed.
बरें. प्रस्न असो आसा विधेयक मानून घेवचें जांकां तें मान्य आसा ताणें हय म्हणचें, जांकां मान्य ना ताणें ना म्हणचें. हय म्हणटाचें म्हणणें मान्य जालें, हय म्हणटाचें म्हणणें मान्य जालें. गोंय वित्तीय लागणूक आनी अदमासपत्र वेवस्थापन दुरुस्ती विधेयक 2022 मान्य जालां. सभागृह मुखार आनी कांयच काम नाशिल्ले कारणान सभागृह मंगळार तारीख 19 जुलय 2022 सकाळीं 11:30 मेरेन स्थगीत करता.